Good laboratory practice. Good laboratory practice is a formal regulation that was created by the FDA in 1978. Good laboratory practice embodies a set of principles that provides a framework within which laboratory studies are planned, performed, monitored, achieved, and reported. Purpose of good laboratory practice. Good laboratory practice is to certify that every step of the analysis is valid or not, assure the quality and integrity of data submitted to FDA in support of the safety of regulated products. Good laboratory practice have heavy emphasis on data recording, record, and specimen retention. 10 principles of GLP. Apparatus, materials, reagents, test systems, test and reference substances, standard operating procedures, facilities, performance of study, reporting of study results, storage and retention of records and materials, testing facility organization and personnel, quality assurance program. Test facility organization and personnel. Responsibilities of study personnel. Having the knowledge of the GLP principles, access to the study plan and appropriate SOPs, comply with SOP instructions, record raw data, exercise health precautions to minimize risk, and ensuring integrity of study. Quality assurance. Responsibilities of quality assurance personnel. Access to the updated study plans and SOPs, documented verification of study plan compliance to GLP principles, inspections to determine compliance of study with GLP principles, inspection of final reports for accurate and full description, report inspection results to the management, and statements. Facilities. Facilities should have suitable size, construction, location, and storage rooms, adequate degree of separation of different activities, isolation of test systems and individual projects to protect from biological hazards, suitable rooms for the diagnosis, treatment, and control of disease. Apparatus, materials, and reagents. Apparatus of appropriate design and adequate capacity. Documented inspection, cleaning, maintenance, and calibration of apparatus. Chemicals, reagents, and solutions should be labeled to indicate identity, expiry, and specific storage instructions. Apparatus and materials not to interfere with the test systems. Test systems. Physical and chemical test systems, biological test systems, records of source, date of arrival, and conditions, proper identification of test systems in container or when removed, cleaning and sanitizations of containers, and pest control agents to be documented. Test and reference items. Receipt, handling, sampling, and storage, characterization, stability of test item in its vehicle, samples for analytical purposes for each batch. Standard operating procedures. Written procedures for laboratories program define how to carry out protocol-specified activities. Written to explain how procedures work, contains actions to be taken in response to equipment failure. Routine inspection, cleaning, maintenance, testing, and calibration. Keeping records, reporting, storage, mixing, and retrieval of data, and analytical methods. Performance of study. Step 1. Prepare the study plan. Step 2. Determine the content of the study plan. These include identification of study, records, dates, reference to test method, and information concerning the sponsor and facility. Step 3. Conduct the study. Reporting of study results. This includes quality assurance program statement, experimental starting and completion dates, information on sponsor and test facility, description of materials and methods, results, and storage. Storage and retention of records and materials. Index of materials retained, maintenance and calibration data, standard operating procedures, inspection data and master schedules, study plan, raw data, and samples. What to do for good laboratory practice? Keep things at its location after use. Store heavy things at the bottom or on trolleys. Follow everything has a place and everything at its place principle. Give name and location to everything. Follow first in, first out to prevent all accumulation for laboratory chemicals. Put ladders for things stored on top. Identify everything with its name or purpose. Prepare location list and display it. Benefits of good laboratory practice. 1. Give better image of company as a quality producer in global market. 2. Provide hot tips on analysis of data as well as measure uncertainty and perfect record keeping 3. Provide guidelines and better control for maintenance of instruments, environmental control, preservation of test records, etc. 4. Provide guidelines for testing and measurements in detail.